Hi, I'm Dai Chung, Chief Medical Executive at Children's Health and UT Southwestern Medical Center. Welcome to the In the Know video series. Let's talk a little bit about partnership between Children's Health and UT Southwestern.
We have world experts in every one of these conditions here, and we're treating them with state-of-the-art medications that, frankly, some of them were actually discovered right here. There's only a small handful of centers in the entire United States that can do this procedure that we call IAC for short. What this allows us to do is to actually put the chemotherapy directly into the eye. And this is something that requires a multidisciplinary team that have made this truly one of the best centers in the country.
I would say that we embrace multidisciplinary approach very close to our heart and would say to its fullest extent. We have lots of unique programs that will distinguish from other folks in the country. One of them is the program that is acute care nephrology program. The goal of the program is to standardize care for these critically ill children when they have to receive chronic renal replacement therapy, or known as CRRT. So this CRRT is provided across the PICU, the CVICU, and the NICU.
Giving us that infrastructure to really bring cutting-edge innovation and research and new treatments is what I think of when I think of the strengths of the partnership with the university.
I do want to talk about Tzield. So Tzield is the first disease-modifying agent in the field of diabetes. This medication will delay the development of stage 3 diabetes by an average of 2 years.
The partnership between UT Southwestern and Children's Health has really bolstered academic progress. We're one of the few sites in the country to be offering microvascular fibula growth plate transfer to reconstruct bone. And so we have quite a large series of preserving the physis in the fibula and then matching that to an arm to grow as the child grows. This is perfect for a really young patient that has a sarcoma diagnosis, and we're seeing just phenomenal outcomes.
The mortality risk for kids on the wait list for a heart transplant is the highest of any organ, and we've managed to decrease that substantially here with our use, especially of ventricular assist devices, to help provide kids with effective heart blood flow and effective delivery of oxygen to their body.
We're getting a lot of patients who may have not been able to survive that time while they're waiting for transplant, and we're getting them healthier.
It's an amazing environment. Across the board for gene therapy in general, I mean, we're seeing treatments approved for things like spinal muscular atrophy, for Duchenne's muscular dystrophy.
But then we have these cell-based gene therapies that have gotten approved for adrenal leukodystrophy and metachromatic leukodystrophy.
We have a large clinic where we follow a large number of these patients, and walking into the clinic is completely different now than it was 20 years ago.
We're in a situation where as academics and as care providers, we have exciting technology, we have patients with enormous unmet need, and we're trying to bring those together. The cutting edge equipment, cutting edge expertise that I have access to. I can do so many things here that I could not dream of in other places.